So we chose coronavirus as our health-related topic. I'm Ireland.
I'm Lexy.
Ava.
There are 3 lesson objectives that we have. The first is how to prevent and take necessary actions to help contain the virus. The second is what Pennsylvania is doing to assist residents on staying safe from the virus. And the third is to inform the population about the dangers of this pandemic. A misconception among people is that the coronavirus and the flu are basically the same, and while they have really similar symptoms like fever, sore throat, cough, fatigue, the coronavirus is much more dangerous, and you also have a fever, or you also have a symptom that's shortness of breath, and the symptoms typically show up 2 to 14 days after exposure. While with the flu, you experience body aches, headaches, and nausea or diarrhea, and these symptoms present themselves 1 to 4 days after exposure. It's believed that the origin of this virus is Wuhan, China, from a seafood market where they sell wild animals. And bats are a natural origin of various types of coronaviruses, but we're unsure if that's the case for this one. The virus is easily transmitted between family members and friends who have closely encountered a patient or carrier, and it's commonly transmitted between healthcare workers caring for patients with the virus. Direct consumption of wild animals or immediate host animals is considered the main form of transmission, and that's why it's suggested that the seafood market is a source for this virus.
How does this virus affect traveling? Well, quarantine and travel bans are often the first response against new infectious disease. Quarantine refers to the separation of persons or communities who have been exposed to an infectious disease. Isolation applies to the separation of persons who are known to be infected. Federal quarantine power is restricted to avoid the spread of communicable disease into the country or across state lines. According to the New England Journal of Medicine, Section 361 of the Public Health Service Act grants Surgeon General the power, which is delegated to the CDC, to detain or issue a purpose of preventing a disease from entering the country or spread across state lines of a quarantable disease and severe acute respiratory symptoms fall into the category of COVID-19. The 3 most common symptoms of the coronavirus, here are some statistics about the percentages of patients and what symptoms they experience. 88.8% of confirmed cases experienced a fever, 67.8% experienced a cough, 38.1% experienced fatigue.
Moving on to the precautions that Pennsylvania is taking for COVID-19, the Pennsylvania Governor, Tom Wolf, has closed down all restaurants. You can only do delivery and carry out. He closed salons and all non-essential businesses. All the colleges in Pennsylvania have moved to distant education models, so everything's online. People are only allowed to leave their house if they have a doctor's appointment, need to go grocery shopping, medical emergency, or if you have a waiver that says you're allowed to leave for a specific reason. They want us to practice social distancing, so this means staying at home as much as you can, avoiding public spaces, keeping at least 6 feet between you and someone else. Don't attend or host large gatherings, and avoid using mass transit. Treatments for this, the current therapy treatments are nearly all patients accepted oxygen therapy. The WHO has recommended that extracorporeal membrane oxygenation to patients with refractory hypoxemia. There's rescue treatment with convalescent plasma and immunoglobulin G73, which is delivered to some critical cases according if their conditions worse or not. There's no cure yet, but there are antiviral treatments. It has reported that a beta coronavirus viral loads of a COVID-19 patient in Korea showed that their symptoms significantly decreased after they took lopinavir and ritonavir treatment. Some assessment questions we have for you. The first one is, according to the CDC, how far in feet should you stay away from a person? Is it 5, 10, 6, or 8? The answer is 6 feet.
Assessment question number 2 is, who could you contract COVID-19 from? A family member in the same house, person sitting next to you on a plane, or going into party with friends, or all of the above? And the answer is D, all of the above. Assessment question number 3 is, what is the most experienced symptom of COVID-19? Cough, fever, shortness of breath, or fatigue? answer is fever. Last but not least, here are our references and additional sources for information about the coronavirus you can find on the CDC website.
That is it. Thank you.
Yeah.